The improvements that have been made in modern medicine have saved countless lives. Many cancer diagnoses that used to be an immediate death sentence now have various treatments that give patients extra years with loved ones. However, Dr. Lauren McCullough, Associate Professor at Rollins School of Public Health, says the progress has left some communities behind, particularly Black women.
We like to share that we've made lots of medical advancements in terms of cancer, both diagnosis and treatment, but Black women largely haven't benefited from many of those medical advancements. And I can give you an example. In breast cancer, in the 1980s, we introduced both mammography, so screening for breast cancer, as well as endocrine therapy, which targets cancer, making it better or easier to treat. And since 1980, that's when we've seen the disparities grow. And so it's with the introduction of new medical technologies where we really see some of the biggest gaps in terms of race for cancer.
These gaps have been well documented for decades, not just for access to healthcare, but also in life expectancy after diagnosis.
When it comes to cancer, Black women are more likely to be diagnosed with late-stage disease and also more likely to be diagnosed with cancers that tend to be more aggressive and harder to treat. And because of this in part contributes to the disparities in survivorship that we see among Black women. What we know is that for most cancers, with very, very few exceptions, Black women are less likely to survive once being diagnosed with cancer.
There are many known factors that affect survivorship, including poverty, a patient's insurance, and proximity to care. But McCullough says there's a part of the puzzle that we don't yet know. Many of the factors can seemingly be attributed to low income, but research shows that even in higher socioeconomic neighborhoods, the disparities are still obvious.
And so there's a lot that we don't know about the presence of comorbid conditions, which may impact treatment, what we don't know about racism and discrimination in the healthcare setting. We also haven't really contended with some of the environmental pressures and impacts that disproportionately affect Black women.
These blind spots in research have sparked the genesis of a decades-long study called Voices of Black Women. Led by the American Cancer Society, this research will span at least 30 years and involve 100,000 women. McCullough is a principal investigator on the project. The rest of the team is made up completely of women, most of whom are Black, which McCullough feels is important to the success of this research.
Even though I am a single Black woman and by no means represent all Black women, I think the context by which I have had to navigate and live my life helps to inform the study. It helps us to think about what types of questions we want to ask, the sensitivity by which we want to ask them, and also being able to honor and respect this community in a way that you really can when you have that representation on the study team.
It's also important for building a foundation of trust with women that are dedicating years of their life to be a part of this research. While 30 years is a long time, McCullough says it's necessary to be able to understand the whole spectrum of this population. We need to pinpoint the different factors of a 25-year-old's journey with cancer compared to a 60-year-old's.
So by following over a long period of time, we'll be able to inform what's happening on both ends, both for younger women under 40 and for older women. We'll also be able to look at different types of questions over the life of the study. So early on, we may be able to better describe the environments that women are contending with that may influence their cancer. Midway through the study, we may get at those early questions about why more aggressive cancers. And then we imagine that after a decade or so, we can start to think about survivorship and mortality from cancer.
Many long-term studies have strived to be racially diverse, to encompass all perspectives. But McCullough says that the minority participation is often too low to research the more specific questions. And so, Voices of Black Women is only focusing on one group, rather than comparing multiple communities.
We know that the counterfactual of a Black woman is not a white woman. And so rather than trying to address disparities, we really want to be able to optimize minority health. And so having a study that is homogeneous with respect to race is going to be important because we know that there are some Black women that do well, and there are other Black women that don't do well. And what we want to do is to be able to inform those that don't, well, what's happening in this group that does?
As we mentioned earlier, the issue of access may be one of the most discussed contributors, but McCullough feels like that's just scratching the surface. The study will question women on the social and structural barriers that exist, because all aspects of life factor into improving health outcomes.
We're not just treating the biology in terms of cancer, or we're not just treating the social barrier in terms of access. We're treating the total person. And that person exists within a community, which exists within a larger infrastructure that impacts how they interact with the healthcare system and the type of healthcare they get. And so as researchers, I think we have to get out of our silos of what we do and start to think about what are all the various aspects that impact a person's health.
The study will also examine how these factors impacted previous generations. Our ancestors have an influence on our health, which is evident when breaking down your family's medical history at the doctor's office. But even with the historical insight, it can still be shocking when the same conditions start showing up in our own lives. Danielle Musselman's grandparents both died from cancer, but she still felt blindsided when the same diagnosis came for her mother.
It's like I remember right in where I was in my house whenever she called me and told me the news that she had breast cancer. And she was young. I mean, she was in her mid-50s and certainly and was completely healthy. Certainly wasn't anything that was on her radar, but luckily she was diligent about her mammograms and such, and that's how it was detected for her.
Musselman's mom immediately underwent a double mastectomy and chemotherapy. Luckily, she's been in remission now for more than 15 years, but some of her friends didn't have the same luck. Based on this family history, Musselman feels a duty to participate in McCullough's study. She hopes it will finally bring some well-overdue answers, if not for herself, then for her daughter. The interesting part of this cancer research is that participants cannot have been diagnosed with cancer in their lifetime. McCullough says this will allow them to study all aspects of the disease progression over time.
One of our essential questions is, why do Black women develop more aggressive cancers? And so we can't actually answer that question if people already have cancer. So we have to start with a group of people that aren't affected with cancer, be able to follow them over time to understand what are their exposures, what are their experiences, what are their behaviors. And then we can figure out those differences between women that develop no cancer versus a less aggressive cancer versus a more aggressive cancer.
Committing to a 30-year study may seem daunting, but the actual amount of participation is very limited.
Over the next 30 years, we will contact participants just twice per year, 2 30-minute sessions. And so what I try and remind women is 30 years feels like a long time, but what we're asking is 1 hour of your time every year for 30 years, which basically equates to essentially 24 hours over the course of 30 years, about a work day. So it is a long period of time, but it's also a very small investment for potentially really robust gains in our knowledge around Black women's health.
Musselman's been involved with the American Cancer Society for years by organizing fundraising and charity events, so her participation was a no-brainer. And while not everyone has that deep of a connection to cancer, Musselman says that sadly, there's good odds that it will affect you or a loved one at some point in life.
About a year ago, my closest friend here in Arkansas was diagnosed with multiple myeloma. And I remember the doctor said, don't Google it. And she didn't Google it and I did. And some of the things that it says, are just horrible. And I have learned that this is a cancer that like 10, 15 years ago, that it was a death sentence. And through cancer research, she is healthy. The doctor said, you're going to die of something else one day, but not because of this. And that's only because of cancer research. And so I've seen it with my own eyes. You know what I mean? I've seen someone who has been the benefit of cancer research. And I just know, even with breast cancer, that's one of the ones that they've just come so far, but there is still a lot more that they need to know when it comes to Black women and breast cancer outcomes. And if we don't participate, they're not going to be able to find those answers.
Anyone interested in participating in this research can learn more at voices.cancer.org. You can find more information about Dr. Lauren McCullough, Danielle Musselman, and all of our guests on our website, radiohealthjournal.org. Our writer-producer is Kristen Farah. Our executive producer is Amira Zaveri. I'm Elizabeth Westfield. This segment is brought to you by the Capital One Venture X card. Earn unlimited 2x miles on everything you buy. Plus, get access to over 1,300 airport lounges and a $300 annual credit for bookings through Capital One Travel. What's in your wallet? Terms apply. Lounge access is subject to change. See CapitalOne.com for details.